Magnetic resonance angiography is often called dye-less angiography because you can get a contrast of the blood vessels even without injecting iodinated radio contrast as in conventional angiography. Hydrogen nuclei which are plenty in blood have a change in their characteristic when exposed to high frequency radio signals. So this is the basis for magnetic resonance angiography, earlier called as nuclear magnetic resonance. And earlier it was thought that you can have magnetic resonance imaging very much safer in patients with renal failure. Now, as gadolinium based contrasts are being used for magnetic resonance imaging, that cannot be used when there is renal failure, as there is a chance for progressive systemic fibrosis, which is known as nephrogenic systemic fibrosis, which can occur with the use of gadolinium based contrast for magnetic resonance imaging. This is an MR aortogram. You can see the entire extent of the aorta, starting from ascending aorta, arch of aorta, descending aorta into the abdominal aorta. This is descending thoracic aorta. This is descending abdominal aorta. Major visceral branches are also seen here. You can see the heart, which has plenty of blood, and blood vessels of the lungs are also seen. Arch vessels are seen here, the carotids and the subclavian, all are seen in an MR aortogram very well. This is a magnetic resonance aortogram showing the bifurcation and proximal vessels to the lower limbs. Descending thoracic aorta is apparently normal. These are the renal shadows. You can see the left renal artery, the proximal portion is almost normal. You can see the right renal artery here. There is narrowing of the origin of the right renal artery. As you go down, aorta is having severe disease. The bifurcation has severe disease, and the common iliac on the right side is totally occluded, and it is reforming by collaterals. Collateral blood supply is causing reformation of the lower limb arteries on the right side. Left side also, the common iliac has distal disease, almost going into a total occlusion distally when it comes to the external iliac region, and then it is again reforming through collaterals. So you get an entire extent of the disease from the infrarenal aorta down to the proximal part of the lower limb vessels. You can also scan it downwards to see the more of lower limb vessels up to the foot.